All right, everybody. It is the Live Healthy Metro East podcast again, and I've got a live guest.
Yeah.
And I think the last time we did this, we were together.
We were.
Dr. Bill here has not been, it's not his first time on the podcast, but we are going to talk a little bit about some different things today. And how long have you been a part of our facility now? It's been over 2 years?
It's been about 2.5 years.
Okay,
It was 2 years ago in October. So October
Right.
24.
It was
been
October
2 years.
was the turnover of some point. Yeah.
Right. So looking at about 2.5 years.
Yeah. So for those of you that maybe frequent our gym or see us on social media, you guys see a lot of, our partnership with Myofit Mobility Therapy STL. Bill is the owner and founder of that. I want to bring you on the podcast today, one, just to talk a little bit about, you as who you are as a clinician, also just kind of how you got here and got where you're at now. And then maybe dive into some of the things that, maybe that you're passionate around or that you encounter in what you do, not only for our clients, but also for people all over the Metro East and St. Louis area. So yeah, tell me a little bit about that.
Yeah. So how I got here, right? I think that's always origin stories are always fun. I was an athlete growing up, like most people who enjoy fitness and enjoy helping people. I think we all kind of start in that realm somewhere. So, grew up playing football, basketball, baseball. In my junior year of high school, ended up just playing football, basketball, encountered some injuries, got to meet what an athletic trainer was for the first time, and spent some time getting some treatment from an athletic trainer, and was really interested in what is this, right? Like, I didn't know this kind of existed.
Yeah.
It was a little different than, a physical therapist who was only at the clinic, and, so started to learn a little bit about that.
Yeah.
Right. And really just became interested in sports medicine, athletic training from that point. Had the ability to kind of grow up from there in a local physical therapy clinic that had athletic trainers. And so really got to shadow them and learn about that environment and how we could help people in that realm, right? Also got a lot of experience at that time with the fitness side of that business. And, so really learned a lot and grew a lot my junior and senior year in that realm, but then continued to stick around through college, right? And in those clinics, and, ended up playing football and baseball for a brief period of time for 2 years at McKendree University, was studying athletic training there. And my junior year there decided to not play sports and really wanted to focus on athletic training, right? And really just jumped in with both feet and spent way more time in the AT rooms than I could imagine. But it was good because I learned a lot. You learn things by being around, not just by what the books say and those sorts of things. So I ended up graduating from there, from McKendree. I became a licensed athletic trainer in the state of Illinois. At that time, I ended up working back at that clinic that I had the opportunity to be with, and was there for a period of time treating a full caseload of patients alongside a physical therapist, and decided that I didn't really want to be in that environment at that time. So I decided to go on to graduate school at that time, went to Ohio University. I got a master's degree there, again, studying sports medicine, whatever the name was at that point in time. But
like there was like a lot of different names happening in that.
Yeah, it's a long name, but at the end of the day, it was about sports medicine. Yeah. But also at that time, did some studying for my CSCS degree because I wanted to have this strength coach background to apply to the injury side. And so I wanted to bridge that gap a little bit.
Yeah.
Right. So earned my CSCS degree while at grad school, came home after, and was employed at McKendree University for, probably 6 years. Yeah, I think it was 6 years, 2004 to 10. Yeah, so 6 years. Was teaching in their education program, their athletic training education program, as well as covering football, wrestling, and baseball for them. And that's actually where we met and where our relationship
was my teacher.
Yeah, how about that? From there, so 6 years, spent 6 years at McKendree, ended up taking a head athletic trainer role at Lindenwood Belleville here in Belleville.
Yeah.
Spent, gosh, probably 5 years there as the head athletic trainer, and then rolled over into academics. Started an athletic training program there, managing that. Really saw the writing on the wall for the university and decided to had the opportunity to go over to the St. Charles campus and be the clinical education coordinator over there for their athletic training program. So spent another, gosh, how many years was I? So I was at Lindenwood as a whole for like 12 years, right? Between being the head AT and then doing some academic things. While I was at Lindenwood, though, I was pursuing a doctorate degree at Lindenwood. So earned that in 2017. And then I don't even know what year it was at this point. So let's call it 3 years ago. So 2022, roughly.
Yeah.
Logan University reached out. They were starting an athletic training program at the chiropractic school. So I slid over there, right? Was excited about starting a program there. A week before we were going to kick off the program, students were supposed to arrive. We get called into a meeting and it gets squashed. And so, cool thing was they kept me on my contract till the end of my contract. So I had about maybe 5 months to kind of figure out what I wanted to do. And from there, I really just started to think about like, if I had this opportunity to start over and do something from the ground up or just to do something different, what might that look like, right? So I was looking at a lot of things, right? I was looking at, did I want to be in like the industrial setting and working with our industrial athletes, or did I want to go back to education somewhere else, or did I, so I just really got the opportunity to think about like, what am I passionate about and how can I apply that to the community, right? And so had a lot of conversations with some mentors and people that I really respect, and we started to land on this idea of like, how cool would it be to be able to offer athletic training services that elite athletes get just to the general public. That was exciting, right? Because it was an avenue that's not that it's not available everywhere. Right. There are some clinics around the country, but it just isn't a very common thing, right? And so from there, I started to think about, well, is this something I want to like try to build from the ground up, or do I want to essentially purchase somebody else's experience? So I started to look at other companies and franchises and different things. Really fit well with this Myofit group that started out in Indianapolis, and really liked what they were doing and what they stood for and those sorts of things. And from that point, decided like, yeah, it's probably best to buy some years, in essence, right?
Yeah.
Like I bought their mistakes essentially, right?
Absolutely.
And I thought that was real important at that time in my early 40s, and had a family and kids at home. And it's like, yeah, I could probably do this, but do I want to make all the mistakes?
Right. I need to start from true scratch.
Right. And so that's where Myofit STL was really born, right? So Myofit in Indianapolis is kind of what we call the mothership or the mother hub, right? And then we have a branch here in St. Louis that I own and operate, and then there's actually a branch in Atlanta.
That's right.
That another lady operates down there. Yeah. And so that's where Myofit was born and how I landed here at this point in time.
Yeah.
So.
You talked about a little bit, obviously, being in education for as long as you were. Maybe some people would think that's a little different than treating patients or treating athletes. When you, like now, you're obviously not in education at most capacities. Obviously, if you do a little something with some of the local universities. But did you ever really stop treating?
No.
And
a lot of PRN stuff that I did, and I just because I really enjoy helping people, right? Keeping athletes safe, keeping people safe, and letting them do the things they love and in the way they want, right? And so from that perspective, no, never really stopped treating from that perspective. But then from an education perspective, as you're teaching these things, it may not be a live injury per se, but you have to teach those skills to
Yes.
manage this condition or that condition, and what does it look like, and how would we care for it if it looked like this versus this, all those sorts of things. So never really stopped,
No.
From that perspective.
Yeah, and I think that's a really important point that you make in the athletic training education setting. One of the biggest things we always talked about was our checkoffs, right?
Yeah,
Back in the day.
sure.
And so as we kind of mentioned, Bill and I met and connected at McKendree University, where I was pursuing my athletic training degree. And Bill was one of my professors. But one of the things that we did a lot of was, we had a book, this thick every semester of the things we had to know how to do. And it was a ton of practical application, not just what the book says. Now, the one thing I always valued was you and the other professors there and the other instructors there did such a great job of giving us practical application from real world experience. And so I can't imagine how beneficial that was to your athletic training students at each of the places you were teaching at, that you could provide that. And I also knew it was a little bit of a loaded question because I knew you never really stopped
Sure.
being on the field,
Yeah.
right? I've known you to, have either hockey coverage or soccer games or whatever else it may be. And so you've constantly been treating, but it sounds to me like the thing that you're really passionate about that really led you down the Myofit path was really treating people to help them be able to do the things that they want to do.
Yeah.
How does that work now? And obviously, previously you were treating athletes or treating teams, and you had an athletic training room that athletes would come to or whatever else. How does that work now with Myofit? How is your structure, and how do you serve the population now?
It's very different and unique in the field of athletic training. It's cash based. You pay for the service that you're going to receive,
Mm-hmm.
right? Like, it allows us to have freedom and flexibility to treat people where they're at on their terms, without insurance really dictating what we can and can't do.
Yeah.
Right. Which I think is important, right? I think about these athletes that I used to treat in these athletic training rooms at universities, and we might have an ACL surgery, right? Tore their ACL, they come in, we treat them for as long as they need to be treated. Right. It might be 6-8 months. Early, it's every day. Later in that journey, it might be a couple times a week. Where now we see a lot of athletes who are, if they're using insurance to go get this same care, maybe at the local, physical therapy clinic down the road or whatever, their insurance company might say, you have 12 visits. Right.
Yeah.
So, or they might say, you have 24 visits, and that still only gets you to month, maybe 6. Right. And no wonder why we have all these re-injury rates, right? Because these folks aren't maybe getting everything they need. And that's not a knock on the physical therapy clinic down the road.
No,
It's a knock on the system of this sick care system, right? In my mind, it's not healthcare; it's sick care. Let's get you back to the minimum and send you on your way.
Definitely.
Right.
Yeah. And I think that's a key component to note here, is that if you're someone that goes to a physical therapy clinic, or you go to your physician, and so Bill and I also stayed connected for a really long time, even after college, because Bill got me my first gig working for the same clinic that he worked for as he was coming up. And so both of us worked in a similar setting of athletic trainers and physical therapists working together, fitness center work as well happening there. I remember in the physical therapy setting is that, the physical therapists had units that they could bill for. They had billable units, right, that they were trying to meet. And so, but there were certain cases, and maybe a Medicare case, that they didn't have enough, like, oh, I can't actually do this treatment because it's not billable under the diagnosis maybe you have. But maybe they felt like this would be a viable treatment for this patient, but I'm a little handcuffed in what insurance will pay for it, right? To whereas, and then on top of that, if you go to your physician might approve 12 visits right away. But at the end of those 12 visits, your physical therapist might have to evaluate you and assess, okay, where are we at on the spectrum? And maybe that physical therapist can, go to bat and say, hey, doc, I need a few more visits with this person. And maybe that doctor can give you that, but maybe your insurance isn't going to allow that to be approved, right? And so they are handcuffed by the system, like you said. And so what is happening now in our world today is we do have this prevalence, or this you know creation of non-insurance paid service that's occurring, whether that's through physical therapists in their own cash-based services or athletic trainers providing care in their own clinics, right? And so what that's really done is open up, like you mentioned, open up the opportunity for you to meet the client where they're at and also treat them for exactly what they need.
Right.
Yeah.
Yeah. And the interesting thing there, a lot of times at like the insurance based world, is like if you're there for your shoulder, for instance, they can only treat that shoulder. The second they treat something else, it's non payable by the insurance company.
Yeah.
Right. So, like the way I look at things is I treat things up and down the chain. Right. So, you might have the shoulder injury, but maybe the thoracic spine's not moving well. Maybe the neck has some issues or some restrictions that aren't allowing the shoulder to stabilize or absorb load the way that it needs to. And now I start treating those things,
Yeah.
right? Or and then they're not coverable or
Right.
by the insurance. They're not reimbursable.
Right.
So then they may not even get looked at.
Yeah.
It's like, oh, you have some neck pain. Well, it's really related to the shoulder, but I can't really touch that.
Right.
Where here it's like we're going to look at the whole system.
For sure.
A lot of times I'm looking from head to toe,
Yeah.
and we're treating what we find. And I look at that a little bit too of being not just. I look at it from a performance perspective too, right? It's like we're not just treating people to get them out of pain. We're getting them to move better and perform better so they can enjoy life on their terms.
Right. Yeah, and I think that term performance, sometimes people could perceive that as like an athlete term, right?
Sure.
Like, oh well, I'm not trying to perform at anything. Well, if you're trying to mow your grass or you're trying to pick up your grandkids, or like that's
Right.
your physical performance, right? And we find, and it's continually proven, that people in pain lose function. The reason they lose function is because things hurt, right? And when we lose function, we also lose health. And so that's where we start to trickle down that sickness track, right? And what you and Jack are doing is helping people be less painful, which increases function or maintains function,
Right.
and then allows them to stay healthy versus going down a path of sickness.
Yeah, for sure. Yeah, and I'll give you a perfect example of that. Like I have a current client. She's 76 years old. Okay, she came in after doing, I'll call it the standard physical therapy experience. Yeah. Again, not knocking it, knowing that things have to go a certain way, sure. But she just wasn't better. She's having some low back pain. She's used to walking 2 to 3 miles a day, has not been able to do that without having a lot of pain. Therefore, she started not doing that. She's going out 10 minutes at most, walking her dog and so forth. But because she's having all this pain, she starts losing function, like you said, yeah. Right? Not just her inability to walk down the street. When she first came to me, she struggled getting out of a chair, right? I asked her to sit in a chair and stand up 3 times, right? First one was okay. Second one, a little worse. Third one, she really didn't want to do it, right? Looking at her from that perspective, I was looking at function, not just pain. Like, how do we get her better to live life better? Not just be out of pain, do daily activities. This past week, I had her in. She got up and down out of a chair 10 times with a 10-pound kettlebell at her chest. Yeah. Right? We're talking about a lady that couldn't get out of up and down 3 times. Yeah. Right. So her and I were just discussing, like, how has this changed your life? Right. Right. And she's like, well, I'm not afraid to sit down on the toilet anymore. Right. Yeah. Like, I don't lose my breath trying to do a few household chores where I got to get up and down. Right. Right. Like, so those are little things, but they're also big things if she wants to continue to live independently. Absolutely. Right. Yeah. So just an example of that. Like, you don't just have pain, you start losing the ability to move and lose health and so forth. And
and I mean, I think you said, like, she kind of experienced the physical therapy side of things. Yeah. And, good or bad, might have ran out of visits, right?
Yeah,
Doc
sure.
isn't going to, or the system, this insurance isn't going to approve any more visits, even if Doc wants to give them to you, even if the physical therapist wants to give them to you. And then, but I'm not better, but I can't still do the things I want to do. And it's kind of, unfortunately, in the insurance based approach, it's kind of like a hands up, like, yeah,
Yeah.
I don't know what to tell you,
Right.
right? And how many visits did you guys spend
So
getting
we've
it done?
had 6. So I've seen her once a week for 6 weeks.
That's amazing.
Right.
Yeah.
And so she has homework that she
Yeah.
does 3 or 4 times a week.
Yeah.
Right. That's part of the deal. When folks come here, they're not just getting care while they're on the table. There's an expectation of you have skin in the game also. And part of that's financially. There's some financial skin, but the other part of that is like you got to do your work also.
Well, we talked a little bit about that. I was listening to a podcast the other day. They talk. The phrase was, "If you pay attention."
True. Yeah.
And and we talk to people a little bit. We probably offer a higher priced membership option because we provide a coaching service. It's
Mm-hmm.
not an open gym model that you walk in and just do your own thing and wander around and not really know what to do, and maybe get on the treadmill a little bit, or maybe bounce around on some machines, and maybe you see results and maybe you don't, but there's no one really there to talk to you about
Sure.
your goals or what you're trying to pursue. So we do charge a higher rate for people to be members of ours. That being said, we find that those clients who pay more money are more invested in their health. And so they're more invested not only in the things they do while they're here, but also the things that we're talking to them about doing outside of here, like
Right.
eating healthier or getting to bed on a reasonable time. Like, it's hilarious to me now that I talk to people like that had poor sleep schedules, and then all of a sudden they get 3 months in and they're like, oh my gosh, I have to be in bed by 9 p.m. because if I don't, my workout's terrible the next
Yeah.
day.
Yeah.
And I'm like, man, remember we were talking like 3 months ago and you only slept 4 hours a night? Like, oh no, can't do that anymore. So, but because they're invested, and again, some of that is financially, but also just in their buy in when it comes to, they also know that you're invested, right? As the
Yeah.
clinician, you're invested in them. And I think
Right.
that there's another piece to the insurance based versus the non-insurance based model is that when you go to a physical therapy clinic, and please know, I still refer clients out to a physical therapy clinic if it's the move that they need to make based on what insurance will provide or whatever else. Also know this.
Same. I do as well. Right.
But most of the clients I send out to PT, they go to their PT, and then guess what they do? They come back and I have them see Bill. And it's because I know that more than likely there's maybe a bridge that needs to happen
Sure.
from the sick care or the injured care to the active care now. And I know that we're not just, it's not just like you just flip a switch, right? And so I always like when they collaborate with me and you when it comes to their plan of care moving forward, getting back into an active state.
Right.
But these physicians or these clinicians, as they go to see people, you guys talk about you might have a doc that sees you at your regular checkup and they're in the room for 15 minutes. Well, imagine if a physical therapist is trying to, or athletic trainer in a setting that they're trying to treat somebody holistically, right? Maybe, and they only have 15 to 20 minutes to do so.
Right.
Or they've got to balance that between 3 or 4 or 5 people at once, right? Whereas they get undivided attention when they work with you. And
Yep.
just like when a client works with us in a group setting versus a physical or versus a personal training setting in a one-on-one setting, the speed at which we can help someone in that one-to-one approach when it's isolated work on exactly what they need, the speed at which we can improve their quality of life, their results, their goals, whatever else, like it's crazy.
Yeah. 100%. And I love that part, the one-on-one part.
Yeah.
Like that's so important to me from not just like what you said, we increase the speed of how we can create change, but also just like the relationships we build.
Definitely.
Right? Like that's so important to me that we are caring about our community and caring about our people that are right in front of us. Because we know that as a community, like if that person gets more ill because of their injury, that's bringing the whole system down. Maybe they have this pain that they have, let's say back pain, right? Well, now maybe they fall and now they have pain somewhere else.
Mm-hmm.
Well, now they're going to the ER, right? And maybe it's just musculoskeletal. Maybe it's not, but maybe it is. And now they're taking time and resources away from these emergency settings, right? Of where like people that are sick need to be, right? So those things matter. right?
Definitely.
Definitely over time, those things matter. Interesting thing I was thinking about when you said about sleep with the folks that train here and so forth. I rarely have to have that conversation here because I know it's already being had. But that is a big part of what we think about holistically when it comes to healing and getting out of pain and so forth is, what's nutrition like and what does sleep look like and what's hydration look like and what's our outside stressors and all of those things matter when it comes to pain, right?
Definitely.
Pain isn't just this I have an injury, right? Pain science is really crazy, and there's a whole ball of yarn that has to be untangled,
Yeah.
right, just to get change in pain, right?
Yeah, it is funny that you say like you don't have to have those conversations, but the funny thing is you can have those conversations,
Sure,
and you do a great job. Like I will talk to clients that they're like, "Hey, Bill said I should be on creatine, or oh, I should be on collagen, or what?" Like
sure,
Bill's talking about supplementation, he's talking about nutrition, or hey, he mentioned I should be increasing my protein intake, or and what I'm thankful for is, and to be honest, like I believe that there's other clinicians out there in a insurance setting that want to have those conversations
sure,
too. They just may not have the time or
right.
the ability to, right? But like you said, like that, the the process of healing, the process of pain control, all of those pieces of the puzzle come back to more than just your shoulder hurts, let's treat that, right? And so I think that's a piece of what you're able to do that is massively beneficial to the person that is trying to get healthier. And like you said, that only to me builds more trust, builds more of that relationship that you know they're going to come back to you on a regular basis.
Sure.
Yeah.
Yeah.
So I want to switch gears a little bit. So because we've talked about the things that you can do and the abilities that you've had to be able to take care of people. Do you cross any paths where it's hard to get either people to align maybe with how you treat or what you do, or even like the idea of like, wait, you don't take insurance? Like, what's been your experience with that?
Yeah, sure. So, obviously I have lots of clients that have no problem with the whole like cash idea but there are folks that just aren't right for us,
Right.
right? And that's okay, right? Like I have had folks who've come through my door and they're like, "Wait, insurance thing?" Like, I'm like, "No." And they're like, "Well, I can't afford to do this, or I don't want to pay for this when I'm paying for health insurance," and so forth. And that's totally fine. And I really try to get those folks to places that I trust and people I trust and refer them to the right place,
Yeah.
right? Because I think that's important. That's still part of taking care of people,
Mm-hmm.
right?
Yeah.
On the other side of that, when I have folks who are like, yeah, that's fine. Like I've tried these other things, haven't really seen change. Like this is something you look at things a little different, you do things a little different. I'm willing to invest in myself in that way. And those people buy in, right?
Yeah.
Like obviously, the saying money talks, it really does in a lot of ways, right?
Yeah.
Like when they start paying, like you mentioned earlier, they start paying attention a little bit more. I've actually had some clients who have, didn't pay attention, who didn't do their homework, and we had those conversations. It's like, look, we might not be the right fit for each other. For you to create change in my model, you have to invest and be bought in and do the things that you need to do,
Yeah.
right? And we've shared what you need to do, right? We've given you the homework, right? And you're just not, for whatever reason, you haven't done that, right? And so those folks either do one of two things, right? They either say, yeah, you're right, and I'm going to try to change, or they're like, you're right, this probably isn't a good fit, right? And that's okay,
Right.
right? Like I know that it's not for everyone, right? But I want people bought in because their outcomes are going to be so much better, right?
Yeah.
If I have to twist your arm to do your exercises at home, you're not going to get the change you want.
I'm the guy that he has to twist the arm to do my exercises at home.
Yeah, for sure.
So when when you when you do talk about that, like what people buy in, get going. Maybe some people don't, right? Do you have like kind of a set? I've talked to chiropractors, or I've talked to other clinicians that have said like, if I can't get somebody better in X amount of visits, then I might know that I like maybe I'm not for them, like in the sense of like,
Sure.
I can't. Do you have that? Like, do you tell people, clients that, or you talk to people like that? I know it probably is it depends answer.
Yeah, it is.
Yeah.
I don't have this set number per se
Yeah.
because the reality is sometimes people have been injured or in pain for so long that, 3, 4, 5 visits might not
Right.
even begin to touch the surface,
Mm-hmm.
right? And so I don't really approach it from that perspective. I really approach it from the perspective of like, tell me about what's going well and what's not, right? Like, are you seeing changes in function? Because look, even if you have some pain, if your function's improving, that's a win, right? So I look at it from that perspective.
Yeah.
If there becomes a time where things just aren't getting better, function or pain, we start to have those conversations about like, hey, what's next? What have you done already to diagnose or treat or evaluate what's going on? Who have you seen? Let's start thinking about other ideas, like who might we need to see next, right? So we have those conversations, but never at really a set point, right?
I think it's nice though that you have the freedom to operate in that way.
Yeah,
Because I've sent you clients of mine, which again, like I kind of toe a line that I can go into a couple of lanes based on my education. I always say like I know enough to be dangerous, right? But I really do align with like, hey, this is Bill's lane and I want him to take care of that. So I might have some clients that we might cross a couple paths of like, all right, this is bothering you. Let me see if there's a couple of things that we can do within your PT program or whatever else it may be. And then from there, if this isn't getting better, like let's talk to Bill. But I've also seen you like, I've sent you people and you've been like, hey, do this, this, and this. And then if this doesn't improve, come back and see me. Like all of our clients get an injury consultation just as part of their membership in our partnership. And I've seen plenty of times where someone's walked right out of your room and he's like, yeah, he gave me 2 or 3 stretches to do. And so I'm going to do those for a few weeks. And he told me to get back to him and see if they improved. And so there was no treatment really happening there. Right. But I've also seen the situation where, you could need six sessions with somebody, but you've also gotten it done in 3 maybe. And that's great. And I think it's important too, is that if people are worried about like how much time they're spending on this or how much they're going to be doing or, how many visits, it's kind of one of those things like, and I actually did a quick cast on this just a little bit ago around weight loss, right? It didn't take 8 weeks for you to get where you're at in your body weight, right? And so it's probably not going to take 8 weeks to get there either. And so patience is a virtue here to be able to, hey, let's see how this responds. And I think that's important. Go ahead. Sorry.
No, you're good. I was just going to say, like, on that topic or that subject, right? Like, my goal is not just to get people out of pain. My goal is to get them out of pain, get them back to doing what they want to do. But I don't want them to come back, right? Not because I don't enjoy them or I don't want them as a patient.
Maybe come back for something else.
Right. Like, I want to make them foundationally solid in that area. Like, I don't want that area to be a concern for them again, right? And so along that line, like, I can't generally get that done in 3 visits. Right. I might get you out of pain in 3 visits, but I like to work with folks a little bit longer than that because I want, again, back to that performance idea of like, I want you to be able to perform in the things you want to do without concern.
I don't want you back for the same thing,
right?
Because we really didn't finish the job.
Yeah. And I do get those folks, right, where they're like, I'm out of pain, I'm good, and I do end up seeing them back in the office generally, right, at some point. And then a lot of times we're like, all right, let's do it your way. And then we do it the way that I see fit. And as we collaborate together and we end up solving that issue. Right. And so there's kind of 2 sides of that coin, right? It's like, when I think about treating some of my college athletes, like sometimes the goal is only to get you out of pain because you got to play in 3 days, right? It's like,
and then we'll go deal with this again,
right?
After,
right. In 3 days, we're gonna be back here.
That's how you treat me right now. That's how we
right. Exactly. That is true.
I'm still in the college athlete mentality, unfortunately.
Yeah. So I think there's 2 sides to that coin, right? It's like sometimes when I'm treating some marathon runners, right? They're in my office because they have a race coming up, not because they were there earlier when it started. And so the goal is to keep them running. You got your marathon coming up. Let's find ways to mitigate pain, control pain, get you to a place where you can run, get through your race so that we can come back and solve that issue later.
I know we're running up on time, but I want to hit on like a couple of different quick things.
Sure.
So maybe we can have like a 90-second interval on each one of them.
About knock the camera over.
you mentioned like you want to keep somebody moving, right? And I'm going to load this question because I think I know the answer. Sure. Because we talk a lot about this because our philosophies on this is exactly the same. And I'm so grateful for that, especially to have you who works with our clients because you keep our clients moving so much for us. And so that being said though, how often or how common is it that it's really like, hey, you need to take 2 or 3 weeks off and not do anything while you're healing a knee or a back or a shoulder or whatever else? How often do you prescribe that to your people?
Can I say never?
I always like, I feel like
in
confrontation,
never,
you're not supposed to say never and always and all that, right? Those are like the absolutes, right? But
I wouldn't say never, but it's few and far between.
why is that? Like, why do you feel that way?
Well, one, because
why is that important for people to understand why that we don't do that?
A couple reasons. One, I believe movement is medicine. That's the only way we're going to solve issues is we got to move. Number two, there's always a way to modify a movement to allow us to continue to move. Whether it's a different movement, whether it's decreasing load, whether it's decreasing time under tension, a lot of different ways, right? So I think that's the case. I think it's easy for people to fall into this, I'm hurt, I'm not going to do anything, and then I don't get better, or I feel better, but now I'm not going to move because I hurt the last time I moved. So I try to eliminate these excuses of like falling off the train of movement, right? And then lastly, like we have to load things for the body to create change, right? If we're not loading things ever, we're going to be very fragile. Obviously, that's not what we want for people.
No.
Right. So those are the big reasons for me. Like, just believe we have to move in some fashion.
I think that's hard for us in our settings because so often we end up in a situation where a client might go see their orthopedic. They might go see their GP or whatever else. And so said, like, I'm not supposed to be working out. And usually it's not because, like, if I were to call that physician on the phone and say, hey, Jeff, I've got so and so. They mentioned that they can't do any exercise. Would you mind if we do X, Y, and Z while they're healing up this, or while they're in physical therapy for that, or whatnot, right? And usually, the only reason that a doc might say, or a physician might say, is like, don't do this, is because they don't actually have an understanding of what you do or where you go, right? Whereas our folks work with coaches. They work with coaches that modify and adjust. They have an athletic trainer at their dismay for our coaches to actually, say, hey, Susie's got this painful medial knee and this is what's happening when she squats. Like, do you have any thoughts on this, right? And so we're equipped to be able to handle those things. But most of the time I feel like it's hard to build trust with our folks that, maybe we don't have the same, mental credentials that person might feel their physician has. They might not hold us in that same piece. But like we've mentioned, is that, the physician a lot of times is dealing with the sick population, right? Whereas we're trying to deal with the population that wants to be healthy. And there's a difference there, right? When we care for people. And that's why movement is so important.
Yeah.
Well, I appreciate you talking about that.
Yeah, for sure. To touch on that real quick though, like that is going to be the default answer almost always when you go in for some sort of pain is like, just don't use it.
Yeah, let's just not do anything for a couple weeks, see if it gets better. Right.
And really that drives me crazy, right?
Well, I'm glad it drives you crazy too.
And my favorite one is like, hey, don't squat, right?
Because squatting's bad for your knees.
Right.
Yeah.
But then, I start asking those clients or patients or your gym members, like, did you get out of your car today? Did you use the restroom today? Those are really squats.
Absolutely.
Right. Like, and if we're not going to be able to do them in the gym to build capacity as we age, we're just going to continue to lose the ability to do that.
Correct.
Right. So those are some of my least favorite things to hear, and they're tough conversations to have with folks because they're like, but my doctor said don't do this.
Yeah.
Right. So that's one of my my pet peeves.
Okay. We are up against clock.
Yeah.
So we're going to stop here.
Sure.
But you're doing something really cool with AI right now. And I want to talk more about that. Do you have like 30 seconds to say, or you want to wait for another time?
We got 30 seconds.
We had to check with the next patient.
Yeah, we are. I moved we were offering movement assessments
Yep.
for years,
Yep.
right? Technology is incredible. The ability for technology to screen movements, things that took me 25 years to learn, are being done in seconds, right? And providing information in seconds, right?
Yeah.
This new system I've kind of partnered with is called Kinetisense, and we use an iPad, and the new iPads have the ability to take 3D images, right?
Wow.
3D video,
Yeah.
right? So I can put you in a position of an overhead squat, take a video from the front, and it's assessing all of your joint motions
It doesn't
in a
want to do
3D
that.
way.
That is not good. We should not do that.
Well, we need to do that. For you, we haven't done that
Yeah,
yet for you, but we need to do that. And so then what that information is providing is joint angles. It's providing information about concerns of stability or mobility in our different segments of the body. And literally, I can do like a 12 movement a screen in about 3 minutes, 4 minutes, and it's providing all of this details right back to me. So it's been really incredible. I've used it a handful of times because this is a newer thing that I'm using. I've used it a handful of times on some athletes, some high school athletes, couple college athletes, and we identified some areas that their athletic trainers really hadn't looked at. Not because they weren't treating them appropriately, but they were like, "Oh, I didn't even think about that causing this issue." I had a pretty high level high school track athlete, likely going to get some D1 offers in some hurdles, who was having some growing pain because they were changing his step length from an 8-step to a 7-step.
Yeah.
He couldn't get into a positive shin angle on that ankle, right? Because he had some stiffness. But just looking at him, you wouldn't have noticed that stiffness. But we picked that up on the 3D assessment and then really started to dive into his ankle and was like, oh, yeah, there it is, right?
That's
and so he hadn't run a whole lot this year because of that pain, and he last week threw out the top time in the state and his grouping, and first time at full speed and throws up some top numbers. So just some really cool things that it's able to find really quick, and finding the ability to assess people through some movements has been really fun in that way. Collecting data in that way has been really helpful.
Yeah.
Right. Because on the back end, now we can do some work and then rescreen and see how the work we've done has changed that movement. Right. And so that's been pretty important too.
Well, I think we dab a little bit on the AI side. It's totally different for us, and it's weird, and it's something that's kind of this new frontier that we're pursuing, and maybe some people feel a little scared by it. But I think what this system is doing is really cool. And like you mentioned, to be able to have essentially like all that body of work that you've spent years and years, collecting, and then to have the speed at which something could evaluate for you only allows you to be able to spend more time with the patient to get them better and improve them. So, well, I really appreciate you spending some time. I'm sorry we ran over just a little bit.
All good.
But if people want to, know more about what you do, know how to get in touch with you, how would they do that?
Sure. A couple ways. One, you could just Google search us or go to the website, which is www.myofitTherapy.com. Then hit the St. Louis location. That would be one. You can find us on most socials, Instagram, Facebook, Fit Therapy STL. Those would be the big places. Call, whatever.
We'll drop your contact information in the show notes for sure. Cool. And one other thing, if you're someone that is saying, hey, I don't know about this whole like not using my insurance for things, you guys do take HSA and FSA stuff,
we do,
right?
Yeah.
And so that's really cool too. And that's what we use. That's what I use when I get treatment is I use my HSA account. And so that's something too. Like, yes, you still can use those tax-free dollars that are beneficial to you in those savings accounts through to use your services. So that's awesome.
Real quick on that too, like it's not that we just don't take insurance, but we're technically an out-of-network provider.
There you go.
Right, which means we don't accept any insurances, but there are certain documents that you could submit back to your insurance and maybe be reimbursed based on being out of network.
Great
so that's something else too.
Yeah, that's great to know.
Yeah.
Cool. Well, thanks again, man, for spending some time. I'm sure I want to get you back on here for that AI stuff to talk more about that, especially as you dive deeper into it with your athletes and your clients. But yeah, it's been great. Thank you.
Yeah, thank you.
See you, man.
See you.